My name is Liz Adams. I'm 47 years old. I had the RLE surgery here at Dr. Laser Vision to correct presbyopia, which is nearsightedness. It started where my arms weren't long enough. I just couldn't read the menu and couldn't read things that were close up, and it got just progressively worse, and the glasses were always on and off, and I went with some different contact lens solutions, and then I learned about the RLE surgery and decided to come in and have it done. So I did evaluate Dr. Laser Vision against another laser center, and the reason that I went with Dr. well, first, the staff's incredible. All my questions were answered. I'm like a super picky client, and I called several times and spoke to Dr. Vita, and he explained a lot of the procedure to me. But what I like the most about it is that it's a total vision solution here. It's not an a la carte, pay as you go for different procedures. The promise is to correct the problem that you have, whatever they need to do it. And so there's a year-long kind of warranty on the process, which I think is a really great way to approach it. It seems that Dr. Doherty is really about solving the problem rather than trying to sell a bunch of services, and that was the reason that I chose to go with Doherty. Well, the procedure itself went really well. It's about 5 minutes an eye, but I think I was here for about 2 hours because they do sterilize the room in between each eye, so it's 2 separate surgeries on each eye for safety. So I was able to have both eyes done in one day because they do change out re-sterilize the room and all the instruments in between each surgery. I was able to see after the surgery pretty well. I had the surgery done on Thursday. I was able to go back to work on Monday. I didn't really have any pain. I had some blurry vision a little bit, and for those few days, but I was able to see and use my phone and go back to work as normal on Monday. The surgery, I had no complications at all. Everything healed up really beautifully. I will say that there is a stabilization period with the RLE where you're not going to see really your final results for maybe a month or so. I mean, you're seeing beautifully. I was able to go back to work and see right away, but I would say things kept improving over the next 2 months, and after now it's been 4 months since I had it done. I think it's a miracle. I can see at all distances. I can see up close, at the computer screen, and driving better than I could before. So it's a multifocal process that I forget about my vision. I don't even think about needing glasses. I'm not squinting. I'm not struggling to read anything. The night vision was a little bit tricky at first. There is some halos, and you might want to ask to see a picture of what those halos look like if you've never seen halos before, because I was a little bit surprised by that. But that has resolved itself gradually in the 3 months, and I feel comfortable driving at night now. There's still a little bit there, but I'm used to it, and it's manageable, and I'm comfortable. I can drive at night. But the first couple weeks after the surgery, don't be alarmed. It goes away. But I'm reading beautifully. I think it's a miracle. If you're considering it and you're a candidate for it, I say go for it.